Hello again. Criticising the National Health Service makes many people in this country feel very uncomfortable. After all, is it not the case that our NHS is the envy of the world? A shining beacon of excellence which other countries would love to have themselves. The truth is, nobody else in the world can see why a government controlled nationalised health service is a good idea. This is because it is a truly terrible system. A relic of the attempt by a Labour government in the 1940s to emulate the Soviet Union by nationalising everything they could lay their hands on, from railways and coal mines to power stations and hospitals. Hang on, I seem to hear viewers saying, surely the national health system was a great improvement on the situation which had previously existed. Before the NHS began, wasn't it the case that everybody had to pay for medical treatment, and those without money were denied access to hospitals and doctors? Wasn't it like the current situation in the United States? As a matter of fact, the launching of the National Health Service in Britain made very little difference to most people because the same hospitals still treated the same people, and lack of money had not prevented anybody from gaining access to state of the art treatment in the 1930s. Before anybody had even thought up the idea of a nationalised health service. To illustrate this point, I want to consider the case of a typical hospital which existed on the edge of London in the 1920s and 1930s, and to see what it was offering working class people who had no money to pay for treatment. I'm speaking about King George's Hospital in the London borough of Redbridge, although when it opened, King George's was, of course, in Essex. It was just up on the Eastern Avenue at Newbury Park. Didn't become London until the 1965 Metropolitan Boroughs Act. In the description to this video, I give a link to a brief account of the hospital and what it was offering before it joined the newly formed National Health Service in the late 1940s. Although it technically opened in 1931, various units of the new hospital had been built in the 1920s on the same site. From the very beginning, King George's operated on a local level rather than being planned and controlled by some government agency in Westminster. There was a need for a hospital for the newly built Becontree estate, the largest housing estate in the world, where 120,000 working class people transferred from the slums of central London lived. King George's had public wards which were free. It also had private wards which were for the better off who could afford to pay. This was part of its model of finance. Nobody was turned away from the hospital because they couldn't pay. The doctors gave their time free to the public wards as this was an expected code of behaviour in those days. When the king came along in 1931 to open the hospital which bore his name, we read that, accompanied by the Queen on his way to the opening ceremony, he passed through the Becontree estate and visited its newly opened health centre. I can already sense viewers scratching their heads in bewilderment. A health centre in Becontree in 1931, almost 20 years before the NHS started? Of course. And this was free too to those living nearby. How is this possible, do you think? Well, easily enough. Let's look at how a very up-to-date and modern facility was established at King George's 3 years later. I'll quote, in October 1934, a new X-ray treatment department was installed to provide radiation treatment for skin disorders and malignant tumours. It was paid for by the corporations of Ilford and Barking and Dagenham Urban District Council. Between the months of November 1934 and February 1935, some 495 patients received treatment in the new department, and it was completely free to users. You see, this was a local health service paid for out of the rates and also financed by medical insurance schemes to which many working people belonged. It was tailor-made to meet the needs of local people in the area and paid for by a very effective system, a mixture of private and public services, including money from ratepayers. No poor person was ever turned away because they couldn't afford to pay. All that the National Health Service added to this arrangement was an extra layer of bureaucracy, together with all the disadvantages of nationalisation and government control. I suspect that many viewers will not have heard about all this, so effective has been the propaganda pushed out on behalf of the nationalised health service. I'm very much afraid that most of us have been duped by this relentless state-sponsored propaganda until we automatically defend nationalised healthcare and cannot conceive that any other model but this could work, even though the NHS is manifestly not working.